Hey, it's Melanie Petro, and we were just looking at, and Tish, we were just looking at Courtney Cox, and we wanted to share with y'all because really every day we hear somebody say that they're scared of fillers, and there's a lot of reason for people to feel that way because fillers can be scarier than surgery because really anybody can try to do them. And I do a whole lot of fillers. I've been master trained with Allergan, and you know that makes a big difference. And celebrities, I think, are the worst because I don't know if they just go to whoever the other one went to. And a lot of people say, how can it be? I don't have the answer to that or to the bad lighting in here. However, we were just looking at Courtney Cox because she was on the Today Show this morning. But anyway, she had a bunch of injections, and now she's had them dissolved. So you can see, I was just going to show you a few things about this. Sorry, I'm trying to fix this. So you can see, well, look, I can find a pin today. You can see right here. So see how she had some hollow right there? That could be filled real gently, but over here they filled it right in this. Oh, ha. Right in this thing. So when she smiles, it actually pushes the filler up. Hey, Jen, thank you for telling me about this. It really is great. So when she smiles, they put too much right there. So when she smiles, it lifts it up. Her cheeks are ridiculously large, but no one wants to be fat through here. Now, I'm real weird about big noses because it completely distracts me. But her nose does look better. Something else is going on there.
Well, this is in 2015, and this is March of this year. So you can see how much better she looks.
Tweaked her nose, or she just tilted her chin up, or they had better lighting. But right here, when you start putting filler in here, your nose always looks bigger and wider. And that's something, nobody looks better with a bigger nose. Here, it's all in her lips, and what it really does is makes a shadow. Her lips are just too big because she has a pretty smile here, but a lot of what this is these fillers that you put in the cheek are bulky, and you want them to be bulky because you want them to be up higher. And when they're up higher, they can actually help, they can actually help lift this up. But when you put them down here and you try to smile, they interfere with all the little muscles in there. So the muscle fibers are kind of like, muscle fibers need a manicure, but muscle fibers are kind of like this. So they intertwine with each other. And so when you try to smile, it's interfering with the contraction. And so that's a lot of, she can't even smile the same. And there she's learned that nobody looks good smiling after a certain age. Hasn't she learned that lesson? There she's not, that's the only smile, like, I try to always not do a big smile. Here I think she just couldn't because it altered everything about her. And whether you like your smile or not, it is something that people really, it's a real personal thing. So when you alter someone's smile, you also alter the way they look. Now someone's altered that nose, and that's very good. Anyway, she said she looks more like she was, but she could have had it done correctly. She's from Birmingham. It could have been so easy.
She came to see us.
Oh, what is that?
It time's out. I don't know.
What you can.
Well, we're not dealing with that today.
I am going to fix that. So when you do fillers, when I do fillers, I make them really natural. And sometimes we start with less, but you also have to watch people. Like, you really have to look at people. And I hate the lighting in here, but I'm going to show you anyway. So Tish, for example.
Oh, Lord.
So I have filler right here in me. And it looks dark. And it looks like I need a little more right here. But watch. When I smile, it pushes. Ooh, I need some more Botox too. But it pushes up. I know, Christina. Thank you. And if it did that, so I'll take the little bit of darkness. But you have to look at people really, really carefully. And you have to watch them smile. I mean, I stare at everybody. I mean, I do it anyway, whether I'm in clinic or at a restaurant. But when you smile and you see, you've got to watch the way people move and the way they animate. The other thing to that is you also notice that when people are asymmetric, they tilt their head to a certain side. And when they do that, that gives you a hint as to how they look. But studying faces and watching people's faces when they move, when they talk, you know, that's what helps me do the best job in fillers. And I've always been that way because I like, ew. Okay, we're going to talk about her for a second. Okay. Because I like looking at faces. I love faces. Well, I love to think of what I'm going to do to them. So here is Suzanne Summers, who I have just a personal vendetta with. Because
because of the Thigh Master.
I think she should have told the truth about the Thigh Master, because my sweet sister, who's now had lots of cool sculpting and Botox, and I don't need a colonoscopy yet, but she told me, she got me that thigh master and told me she called me thunder thighs when I was little. I know. But anyway, Suzanne Summers, when I saw that, when it came out in the National Enquirer that she had liposuction, I was so relieved because I thought, gosh, I can do it. But it happened to come out like 2 days before I started my general surgery internship. So, and then everybody knew because you could see it. The scrubs at the hospital are really thin and you can't wear your own. So I had to wear this big, thick girdle. And thank you, Suzanne Summers. I would have had it years before had I known that your thigh master was all, I mean, a lie. I mean, that's just, I think if you're going to be a public figure, I think you should tell people the truth anyway. But I think the way she looks now, she looks so bad. I think that she owes it to the world to say, here's what I did. Please don't do that. That's just kind of my synopsis. I can't, yeah, God help her, but I can't help her because I still remember laying in my room when I was like very young doing that thigh master. And all along it was a joke, and I kept thinking, why is it not working? But she knew it would never work. She didn't tell us. So, anything, Tish, you want to lean in? Do you have anything to add? For Tish, we've done...
Not enough.
Well, there's no light right there. I should have sat right there. Lean over.
Well, if I lean over, it distorts things.
I'll always be honest.
So, you can't really see.
Yeah, you can. So Tish has got, she wants more in her lips, right? Mm-hmm. But I like your mouth. So I don't know that I'm going to do much more because nobody's going to believe she went to anybody else. The only thing I could do is put a little bit in the corners, but I'm not going to give her a whole lot more.
No.
Because she doesn't need it. I am going to do something to her neck. She'll let me. A little bit of Cabela. What were you telling me?
Right here.
Here, come stand up.
This is where I want it.
Not you, Gabriel. So tell us.
Right here.
Wait.
Can you see?
So she wants something right here, and what she thinks she wants is a chin, but...
No, I think if you put some here, it would make it look
I don't know what Kegel is. Thigh Master works with the Kegel exercises. I don't know what Kegel is. Kegel. Oh. Well, that's a whole nother level. That's why we have Thermi, Shirley.
Oh, that's classic. No, so I'm thinking if we put some filler right here on my jawbone, like on the jaw.
So what she wants to do... And I would tell her this whether she worked here or not. So right here, she wants to add filler, but this is what she needs. So a little bit of Cabela. We've done Cool Sculpting. It's down. With a little bit of Cabela, I know, I saw that. With a little bit of Cabela, this skin will tighten. And then if she wants to add it after that to give herself more of a chin, then I'd be happy to. But if I did it now and I build out her chin and then I tighten this up, which is what she needs the most, then from the side, so... Here she is now. Once this is gone, you see how much better her chin looks? So if I build her chin out, then I'm going to make it look like she had some there anyway. So I don't want her to look stupid. You know, or fake. I mean, I don't want her to look like somebody plumped it in her chin. We can put some Botox in your chin and it looks like you need a little dermaplane.
I do need dermaplane. Oh, and somebody was asking me the other day about it and what it was like. It's great. Makes your makeup go on so much smoother. Your face just feels great. So, yeah, I need another one.
Okay, well, maybe we'll do that today. Love the lashes or the extensions. Tish doesn't have extensions.
I use Latisse.
She uses Latisse. I don't know how to use something every day.
I don't use it every day now.
Oh, well, they go back the way they were, don't they?
Well, I use it probably 2 or 3 times a week.
Okay, well, that doesn't work for everybody. But I just can't. It's such a little bottle. I don't know if I need to put it in. I keep losing it. That's where I'll... Ow! At least that didn't fall all the way down. All right, well, y'all have a great day. Be careful with the weather.